welcome to Talk Taboo to Me. I am your host, Krista Reed, along with.
Hi, I'm Tracy Ibrahim, the other co host of this fabulous Talk Taboo to Me podcast. And we have the extreme pleasure of having a guest today, Dr. MJ Dohrmann, who has over 30 years of experience working in the field of clinical work and research in sex offenders. So he is here to tell us a whole lot about that and shed some light for us. I'm really excited to get this started. MJ, anything else that you wanted to add to that?
No, I'm just so excited to be here to provide information for y'all.
Excellent. Yes,
Same.
it's a topic I feel like a lot of people don't talk about, and when they do, they talk about it without saying facts. There's a lot of fear and misinformation out there. So that's why we're here, is to just be a show that talks about facts, and people can do whatever they want with their feelings that are related to those facts. So I'm excited about this.
This is a very taboo topic and a very topical topic right now, too. So, yeah, let's get into this.
It really is, with so much stuff going on in the media. So we are just going to get started. I'm going to ask this very first question, MJ. Many people believe that most sex offenses are committed by strangers lurking in public spaces. What does the research actually show about the relationship between victims and offenders?
Yeah, that's an excellent question. And actually, it is a myth. By and large, most offenders perpetrate against people they know, not strangers. In fact, I think it's the Bureau of Justice. Their statistics show that probably 70 to 80% of offenses are against acquaintances, which means that only 20% are towards strangers. Now, they further divide that statistic 70 to 80%, so that 35 to 40% may be against intimate partners, 30 to 45% may be towards friends, and then 7 to 10% may be towards family. So actually, to think that an offender offends against strangers, that doesn't bear in the research. Now, for those offenders that do offend against strangers, they're a little higher risk than the other offenders.
Interesting. Yeah, like what kind of risk would you say is higher? Now I need to know. Inquiring minds need to
Well,
know.
it goes to a higher level of criminality. There's more risk.
I see.
Within families, for instance, they can groom the victims. They can try to ensure some way that the victim's not going to tell or report, usually by threats. But it crosses another barrier to offend against a stranger that they can't control. A lot of the situation in terms of the victim reporting.
That makes sense. Oh, yeah, that makes sense. Because in one, it's personal, it's a little more personal and higher stakes. So you have to jump over more hoops, kind of. That makes
Yeah,
sense.
that makes a lot of sense. And, there's also a widespread belief that people who commit these sexual offenses will eventually, well, they're going to do it again. So, what do long-term recidivism studies reveal about actual reoffense rates compared to public perception?
Yeah, interestingly, you asked that question. So I work at the Colorado Mental Health Institute, the Colorado Mental Health Hospital in Pueblo. So it's our forensic hospital for the state of Colorado, and I train people, new employees, on risk assessment. And every time I do a training, which is a couple times a month, I ask people, do you think sex offenders are at high risk for reoffense? And everybody raises their hand. That's anecdotal, but people just believe that sex offenders reoffend at high rates, and that's actually not the case.
The way you say that, there's this belief that they're going to reoffend. And I think that not only is there that common belief that they're going to do it again, but there's also this common belief that we as a society, we have a tendency to vilify them because like these are some of what we see as like the worst of the worst type of crimes. And to see that there could be potentially somebody that might not do it once, it doesn't have like this this sexual craving, this sexual appetite to do it again. I think our society has a difficult time not maybe kind of like Hollywoodding it up.
Yeah, it goes towards people's perception of the etiology of the sex offending behavior.
Mm-hmm.
Meaning that the perception is these guys are more hardwired into those behaviors versus looking at it from a social learning perspective. And the actual recidivist, so, I said when I train, people will raise their hand, and large numbers will believe that sex offenders reoffend at high rates. The research would say probably most people believe that 80% of offenders reoffend on new sex offenses, which is really pretty high, and the actual number is more like 5 to 15%. It's really a small number of offenders that reoffend, 5 to 15%, whereas society would think 80% reoffend. There's a huge discrepancy in those numbers.
Where do you think that belief
Now,
comes from?
right. Well, I think that probably comes from the media portrayal of highly sensitized offenses that have happened historically. Interestingly enough, because I do sex offender evaluations in the community, and I've done a lot of evaluations on guys who have quote unquote reoffended. But the crimes with which they reoffend are often not new sex crimes. They may be like getting a DUI, or it might be domestic violence. Statistically, for those new offenses that sex offenders may commit, it's actually only 35 to 40% are on a new sex crime. Now, anecdotally, for myself, very few have been for a new sex crime. Most of the reoffense crimes are related to substance abuse.
Makes sense. That makes sense. And thinking more about just people, having these assumptions that most people are going back into society and reoffending. I think a common belief is that people who commit sexual offenses cannot be successfully reintegrated into society safely. What does the evidence say about factors that support successful reentry and lower risk over time?
Well, again, yeah, I mean, excellent question. And it goes back to the perception that the sex offending behavior is hardwired into these individuals. And that's a misperception. If you believe they're hardwired, well, of course they're going to do the behavior again. They don't have a choice. They're just going to continue to do it. But that's not the case. As a matter of fact, they can be reintegrated into the community very well. I think the issue becomes how society treats sex offenders as they try to reintegrate into the community. So if you start looking at how to reintegrate people, the Good Life model by Tony Ward is a good example of how to set up success for offenders. So the Good Life model looks at the needs of offenders in 8 areas, which includes like spiritual, emotional, relational, vocational, right? Basic needs that most of us have. And if you help offenders set up a good plan for their life, that helps them focus on pro-social development rather than their crime. Some of the pillars they say pillars that are needed for success are stable housing, employment, and support. I mean, those are the 3 things that offenders really need to be successful. Now, I mentioned a minute ago that society probably, in their views of sex offending behavior, those guys that commit sex offenses, they create a situation where it makes it difficult for those guys to be successful. It's hard, at least in the state of Colorado, if you've been convicted of a sex crime, it's hard to find a house to live in. People see that you're on the registry, they don't want to rent to you. A lot of employers, they see that you have a sex crime in your history, they don't want to employ you. So that makes it more difficult for them to be successful. Those are the things that they need.
You
100%.
mentioned that, and that makes me think of, because I know there's communities I think there's like a very famous one in Florida that is known to be, I can't think of what they're calling it. It's essentially along the lines of like a pedophile community where everybody there is on the registry, and it's a way for them to have the community but also abide by the fact that they're like so many feet miles away from schools, kiddies, families, and everything. And I don't want to dismiss the fact that none of us here are saying that any of these crimes are okay and we need to, pity these actions of these people. Obviously these crimes are very, very bad. They're horrific, and they cause a lot of extreme trauma. So we're not trying to dismiss that. But what I'm gathering you saying is that it's almost kind of seemingly in our society that we view like a person ending somebody's life, like homicide, being more acceptable than sex.
Yeah.
Absolutely. Absolutely. It's interesting, the stigma that has been placed on sex offenders. I was in a training some years back on pornography addiction, and the presenter said, in our society, it's unacceptable to say black people should all be put on an island and left to rot, or all Hispanics should be banned from the community, or, we just don't say those things. But when it comes to sexual offenders, we do.
Yeah.
And actually, you mentioned Florida. There's different states that do different things. In Canada, years and years ago, in fact, I was still working in Colorado Department of Corrections with the sex offender treatment team when we started learning about circles of accountability, kind of a program up in Canada. So in Canada, they would identify sex offenders as they were coming out of prison, and they would set up a circle of accountability, which could be a family willing to help hold them accountable. It could be an employer, it could be a minister, right? So they would get all these people together as a team, and then they would meet with this individual as they integrated back in the community. And that the success rate for that sort of program is 70 to 80%, meaning very few reoffend.
That's incredible.
In Colorado, a while, it was extremely valuable. In Colorado, they tried to create small housing situations where they could put 2 or 3 offenders in a house that they could live in. They could be all part of treatment, all part of kind of holding each other accountable. That seemed to be successful. Is there a lot of effort into those things? Not so much here in Colorado where I'm at. I mean, it was looked at, but the big success is in Canada with circles of support and accountability. That program has been very successful.
It's fascinating, because I would say that there's a common myth that, anybody who commits a sex crime, like lock them up, throw away the key because they can't be healed. They can't recover from this. But what does research actually say about the effectiveness of sexual offender treatment programs?
Treatment's highly effective, especially when you look at it from a risk needs responsivity model. That's kind of the catchphrase, and most treatment programs, many states have recognized that risk needs responsivity is the absolute way to go. So in the beginning, after an offender has committed an offense, there is an offense-specific evaluation that is done. And that evaluation, depending on the tool, and there's many risk assessment tools like the Stable 2007, the SOTIPS, the VASER, the Violence Risk Scale by Wong. I mean, different people use different instruments. Colorado uses the SOTIPS. But that instrument can identify what their specific risk factors are. Those risk factors become the treatment needs. So once we know what specific risk factor is for a specific guy, that becomes the focus of treatment.
That makes sense.
And then the responsivity, right, then the responsivity is how are we going to respond to that? But absolutely, yeah, when you look at the research, even in 2026, some of the meta-analysis stuff that's happened, 30 to 40% decrease in recidivism for those that were treated versus those that were not treated. So again, when you look at the overall rate of reoffense, it's not that high, 5 to 15%. But treatment increases success 30 to 40%.
That's really, really great. And I think that breaks down a lot of misconceptions maybe out there about people who are sex offenders and whether they are rehabilitatable, whether they, are a certain way.
Well, rehabilitation's absolutely possible. So for instance, the treated group, the reoffense rate after 5 years might be 11 to 17%. For untreated offenders in that same 5 year period, it may be 19 to 25%. But again, this isn't always for a new sex offense. It could be a reoffense to something else, right?
Right.
But that difference between treated and untreated is significant at 5 years. At 10 years, the reoffense rate maybe for the treated group is 21.8%, whereas the untreated group is 32.3%.
Okay. Yeah. I think that really goes opposite to what most people think, which leads me to this. I think the public often imagines a typical sex offender profile, like that person looks like a pedophile. That's what a pedophile is. What do you think about that? Is there a standard profile, or are these individuals more diverse than people expect?
Yeah, there is no typical profile. Sexual offenders come from all groups: rich, poor, young, old, right? It doesn't matter. White, black, Hispanic, all socioeconomic, all ethnic groups, right? Offenders come from all areas of life. The average being 30 old.
Interesting.
95% are men versus 5% that are women. Again, 80 to 90% are known to the victim. They are not picking stranger victims, but it comes from all areas of life. The issue has to do with more some of their relationship difficulties, their beliefs about sexuality and criminal thinking, but that exists in all areas of life.
That makes sense. Do you by chance think that the reason potentially that the female population of people committing sex offenses is perhaps low due to underreporting?
Well, I think underreporting is huge. Absolutely. Just in reporting in general, you have to look at how things are defined. So, if you look at females, what percentage of females have been sexually abused? Most of the numbers will say 1 in 4, but then the question is, how are you defining sexual abuse in that case? Is that molestation? Is it rape? Or is it that you got pinched on a butt while you were walking at a concert? Right? How are you going to define sexual assault? For men, it's 1 in 6. Now, interestingly enough, just speaking on that, we gathered a lot of data in Colorado Department of Corrections when I was there 96, 97, 98 in the program using polygraph data. So we would polygraph sex offenders on their sexual histories. Once they pass those polygraphs, we're pretty assured that that data is accurate. So lots and lots of offenders had reported situations in their sexual history that clearly they were victimized. They did not see it that way. As a matter of fact, I got an offender in my program right now who was forced by an aunt to have sex with his cousins. Starting at the age of 6 through 13. He's having sex with his cousin. His aunt's forcing all of them to do it. He still does not see himself as a victim. Right? There's a lot of barriers.
Normal.
Well, yeah, he was taught that it was normal, But part of the issue for him is he was forced to have sex with a female cousin. He believes that because he was male and penetrated her, that means he raped her. He does not see that the coercion of his aunt to force him to rape his cousin, he does not see that as victimization. In fact, he wants to perceive that he made that choice. So you look at the underreporting, absolutely. I mean, how many 12-year-old boys, how many 13, 14-year-old male and maybe females were sexually abused by an 18-year-old babysitter, 20-year-old babysitter? Society would say, oh, well, you were lucky that you had that sexual experience, but in fact, they were being victimized. If it was a 15-year-old female student with a teacher, she was victimized. If it was a 15-year-old male with a teacher, he got lucky, right? So it really, we really need to be careful how we define things, how we look at things. But to answer your question, Tracy, I think a lot of those variables go to why it's underreported for males. But it happens.
That makes so much sense. And when I was in grad school 20 years ago, I spent a year co-facilitating a juvenile sex offender treatment group. And it's the only time I've ever worked with sex offenders, because after that, I primarily specialized in trauma. So it was really interesting that I was working the other side. I will say it was probably till this day one of the most substantial experiences I've ever had, because it really made me realize that our society just wants to demonize and vilify and give like this generic look as to what these people look like. And these were all, it was ages 10 to 17. I think there were about 8 or 9 of them. And now that I have 2 teenage boys, I'll say they look like the way my boys do now. They don't look different. They don't look odd. They didn't have anything substantial about them. But you talk about that one situation where the aunt was forcing this person to have sex with his cousin, and he sees that as I raped my cousin versus I was being abused. I'm thinking back to some of the stories that these boys went through, and there's this one kid in particular who grew up substantial substance abuse, a lot of neglect, very, very early exposure to pornography. In fact, that was one of the things that his dad would do, was his dad would force him to watch pornography. And I remember in this group, that was one of the things that he had to like really own up for, like, this is not okay to watch pornography and this and this. But hearing you like talk about that, I see that now as he might have viewed him watching pornography with his dad as being like, this was something that set me into this really, really bad state. Like, this is my fault. I shouldn't watch this with my dad. When I'm thinking he was like 4 years old and his dad was horrifically abusive, making his kid watch this because in his dad's mind, he did not want his son to be gay. So he was like, you have got to learn how to have sex. You have got to do this. You have got. And unfortunately, what happened is he then started to flip out on cousins and everything. But even looking back into that experience, I don't remember him ever realizing that that was him being a victim.
Oh, sure. You know, interestingly enough, and of course I'm speaking as a male and talking to 2 wonderful females, but if we looked at how females are socialized versus males, and you guys tell me if I'm wrong, but are not females socialized to believe that they could be victims of sexual abuse?
Absolutely.
I mean, you're almost raised, well, right.
Yes.
Males are not.
You look up just like a quick like Google search of like men's safety items. It's going to show you like safety goggles or like a fluorescent vest or something like that. You look up women's safety items, it's going to show you pepper spray. It's going to show you not how to be safe in like construction zones, but how to be safe amongst men.
Yeah. It's pretty nuts. And I think it's also very normalized. There's a lot of abuse culture, whether it's, you can talk about sorority and fraternity parties, right? There's a lot of offending going on there, but it's normalized as college behavior.
Yeah.
And so I think that also goes to all that mess.
Oh, sure. Military's another one. But what it means for males, though, is that it hits on the trauma, the gender identity stuff a whole lot harder than it does for females. And I'm not saying that being sexually abused is not harmful, but there are some differences if a male's sexually abused because they're not socialized to believe that it could happen to them.
Yeah.
So when it does happen, how they rationalize that then really hits at gender identity issues for men differently than for women. It doesn't attack a woman's femininity if she's sexually abused because she's already been trained to believe that she may be sexually abused. Is that correct?
I mean, I'm going to get really kind of controversial here. This is nothing I believe, and I'm guaranteeing you that none of us do. But if you go into like Andrew Tate type stuff and red pill movement type stuff, a woman who has had any sexual partners, whether consensual or non-consensual, they're damaged goods and they're not viewed as anything but beneath. But that's already a very like sexually like deprived and like fucked up culture to begin with.
Yeah, no, I absolutely agree. What I'm meaning for males is if a male is sexually abused by another male, then it starts raising a lot of questions about am I gay? Am I straight? Why did he pick me? Did he pick me because there's something about me that I don't like girls? And the same thing could be with a boy who's sexually abused by an older female. If he's uncomfortable, why was I uncomfortable? I should have liked this. This should have been, everybody says this was a good thing. I felt uncomfortable. Is it because I'm gay? Right? So it hits at that level of gender identity a whole lot differently.
That's a good point. And it seems to almost demasculate them. And it seems to, I think of, I wish I could remember the name. There's this amazing documentary. It's about an adult male who has been through domestic violence with his wife. And since coming out with this, he had been completely ridiculed. Like women can't abuse men. Women can't dominate men. And calling him all sorts of derogatory names when down to the core, it's like, why do we have to victim shame and make it seem like only women are allowed to be victims?
Well, yeah. And, speaking of that, when I was doing my doctoral dissertation in treating the victimization of sex offenders to see if it would lower their risk to reoffend, I ran into several articles. One of them, you were talking about treating juveniles. One of those articles, when talking about repeat juvenile offenders. If it was a male perpetrator who reported being a victim of sexual abuse was ignored and their perpetration issues became the focus of treatment. If a female repeat offender reported being a victim, their victimization became the focus of treatment and the perpetration stuff became almost ignored. So there's some significant societal differences. When I started in 1996 in the Department of Corrections treating sex offenders, I was trained, and that there was a famous research done by Jan Heinemann, I believe is her name, and they did polygraphs with sex offenders, and according to her data, now this is not consistent with current data, at the time, 60% of sexual offenders, according to her research, reported being victims of sexual abuse, when in reality, after polygraph, only 30% actually were. Now, what that research taught everybody was that offenders lie about being victims to distract from dealing with their perpetration issues. That's what we were taught to believe back then. But then you look at the actual research, you got a lot of guys who were victimized, but they're not reporting being victims because they don't believe they were victims. But the reality is they were. Right. So looking at that data skews things. But bottom line, when I entered in the program in those days, I was told flat out, we are not going to deal with their victimization issues. We are here to treat their sex offending issues. We're not going to deal with their victimization.
That's
And
literally like
and
trying to repair
their
the second story of the house, but the first story is flooded. Like you have to work on the foundational stuff to do anything above it. So that's just mind boggling to me. But I know as somebody that used to work trauma, that's what you would do is like, oh, you don't get into their childhood stuff. You get into the stuff that happened recently. And it's like, but if the foundation's cracked, maybe we should probably do that. And thankfully a lot of things have changed with that.
Yes. It's hard though. I was talking with one of my own clients years ago who did not see that he was victimized. His stepmother, when he was a teenager, started making him have sex with her. And he said, I enjoyed it. She was just teaching me. And I said, well, I wonder though, just sort of the messages that you got from that, the messages that this was your, father, wife, the boundaries. Can we talk about maybe some of that? And he was just like, I don't know why we're talking about this. This is fine. And he had come in to deal with his difficulty in relationships with people now. And I really wanted to go there. But like you said, this is just an example of where it was so drilled in. He was like, well, I enjoyed it. I said, you could have very well enjoyed it. But there were still dynamics happening that weren't the healthiest dynamics to be learning as a young teenager. And he just was like,
That's so fascinating you see that.
absolutely.
Yeah, well, females who have been sexually abused, part of the treatment is working through, of course, that guilt and that remorse of them blaming themselves. And sometimes they'll say, well, there were parts that I enjoyed. Well, sure, because those are very, the nerve endings and all these different kinds of stuff. But that's really interesting. You say that like with the males, like, but I enjoyed it. So it was fine. Where the females were like, I'm having a lot of shame because I enjoyed it. And just the different like media perceptions and society perceptions that influence all of this.
Yeah, well, and in this case, yeah, I enjoyed it. Well, I have an offender I'm working with right now. He moved out of the house when he was 14. He moved in with a guy. The guy that he lived with would come home drunk, and he would come home from the bar drunk. He would give my client oral sex. My client would pretend to be asleep during the whole time, and this is something that happened frequently. And my guy is still saying, well, but part of me enjoyed it. So again, was I gay? Well, the explanation is our skin is an organ, and all of our organs in our body have a function. My liver has a function, my heart has a function, my lungs have a function, my skin has a function. And the function of our skin is to respond positively to touch, right? And it becomes very confusing. So with males, they get an erection. Well, that must mean I like it. Females may have lubricated. That must mean I like it. And in terms of trauma treatment, then there's the issue of, did my body betray me? That is, I did not like this. I was not ready for it. My body responded, so it feels like my body betrayed me.
yep, that makes perfect sense.
So, yeah, I mean, just a lot of issues there, but that is why I decided to do my dissertation the way that I did my dissertation. I was just disgusted with a program that did not want to give any credence to the victimization, and it was very hypocritical. The director of the program, on the one hand, saying, well, we're not going to deal with the victimization of perpetrators. But she would go to victims boards, she would be in the with victim advocacy groups saying, oh, we need to do everything in our power to help victims. Okay, well, what are you doing to help the perpetrators that were victims?
Yeah.
And thinking about that, thinking about treatment and rehab, I think there's a perception that maybe harsh punishment alone is the most effective way to prevent future offenses. What does research say about deterrence versus rehab?
Yeah, harsh punishment doesn't work. That
Yeah.
bottom line. As a matter of fact, it may make things worse.
Yeah.
If you're just looking at using strict punishment alone, that may actually increase offenders' risk than to decrease it. So again, treatment, being able to treat sex offenders using cognitive behavioral treatment approaches specifically. Supervision, so looking at the research, strict incarceration has a very limited effect on recidivism, almost nil.
Interesting.
Now, supervision, on the other hand, has a moderate effect. So you are going to lower recidivism just with supervision. You add treatment to it, that significantly reduces risk. And the combination of supervision and treatment is the most effective. Now, there are a lot of states, Colorado being one of them, and that's where I'm at. We do have what we call lifetime supervision for some offenders. So they have a minimum length of time, and then they're supervised for an extended length of time. That could be 2 years, 4 years, base rate, and then supervision after that. Now, many of them can apply to be off a lifetime supervision, but during that time, when they are supervised and receiving treatment, that has the most effect on lowering recidivism. Just strict, harsh punishment, limited effect, and it may make things worse.
Makes sense. I mean,
Yeah. We think
true.
about we've kind of talked a little bit about the juvenile stuff. So juvenile sex offenses can generate very intense public reaction, and you talk about outcomes, recidivism. How do the outcomes compare from juveniles to adults with treatment?
Yeah, again, that's an excellent question. Juveniles and adults are quite different. I mean, developmentally they're different.
Sure.
So overall, years and years ago, the research was 80%. 80% of juvenile offenders, that probably was just stupid behavior of a kid. 80% of the time, they are not going to go out to reoffend in any way. More recent research that I found, 90% never commit another sex offense.
That's great numbers.
Right. And in fact, you look at the reoffense rates for juveniles, it may be 3 to 7% versus 5 to 14% for adults. And again, you have to look at developmentally, they're more impulsive, right? They are probably not predators. Now, there are some, but again, it's that smaller 10% that may be predators that could reoffend in adulthood. They're more malleable. Teenagers are more malleable, which means that treatment is much, much more effective for juveniles. And for those juvenile offenders that have been treated, the reoffense rate is more like 7% versus 19% for the untreated juvenile offenders.
Interesting. Well, what do you think what might the world look like, or how might it be different if policymakers and the public focused more strictly on evidence-based prevention, rehabilitation? What strategies would receive more attention than they currently do now, if they do even get any attention now?
Well, yeah, absolutely. I mean, it goes to what we've been talking about. If we're just going to look at strict punishment, if policymakers are thinking, oh, we just need to do strict punishment and that's going to solve the problem. Well, it's really not, and that's not what the research says. Again, treatment is very effective. It reduces recidivism. Now, obviously, for the last 30-some years, I've worked with offenders post-conviction. My heart has always been in prevention. So looking at identifying potential perpetrators early, working with victims, those who've been victims, right? Working on that trauma, identifying some of the other problems that go into the development of sexual offending behavior, identifying those cases early, doing prevention, sex education. There's a lot we could be doing in terms of lowering recidivism rather than let's just all lock them up in prison and leave them there to rot.
Yeah, I think that comes a lot from people feeling upset. I think even just maybe even listening to this podcast episode might make certain people upset and say, you know what, people who have been sexually abused wouldn't be thinking that. They would totally support that people should get punished, but I also want to throw out there, just in case that's happening or does happen, I've been personally sexually abused by multiple people multiple times throughout my life. And I also treat sex offenders as well as victims of people who, as well. So I just want to put that out there, that sometimes it's our own stuff that we need to deal with as well. And when we have to sometimes do our best to push aside emotions and look at facts and look at research to really be able to get a better idea about it. Because the way I backed into this field was feeling upset, was I noticed I was working at a psychiatric hospital and somebody who was a sex offender was admitted, and I'm looking through their chart and I just felt angry and like, why are they even here with all these other people? They're going to just, do something, like I'm probably going to get raped while I'm out serving coffee, like, does anyone even care about us? And so I want to say that and put that out there, because I know that's a lot of what's out there. I used to be part of that a long time ago. But in this day and age, paying attention, and I get it, and it's different, and I get
Well,
it based on facts and research and evidence, and I appreciate it.
well, I'm really excited we're having this conversation because you hit on some things that are very, very important. And that is, what about media's portrayal of sex offenders? The media likes to hit on high profile cases, sensationalize kinds of things, stranger danger, perpetrators are incurable, reoffend at high rates. So when we look at policy, is policy being made for the purpose of society feeling safe? And that is important. I don't want to say that it's not important that we keep people safe. But do we make policies for the perception of safety versus actual safety? So there is a thing called the safety paradox, which is we may do things in terms of policy that make people have a perception of safety, but in fact, it's creating a less safe situation. Back to
That's
what I was talking about earlier, those three pillars. Offenders, when they're in the community, need stable housing, they need employment, they need support, right? These are things that they need. But if policymakers do things that make it impossible for them to have those things, they become higher risk. And so it's counterproductive. That's the safety paradox, is that it's counterproductive.
yeah. You talk about the perception of safety. And the first thing that came across my mind is, well, one, I don't know many females who have not been sexually abused in some way, shape, or form in their life. And to perceive that you're safe, I have never felt safe in a parking lot. The only time I feel safe in a parking lot is is when I'm in a group of people or when I'm with another male that I trust. I don't even feel safe if it's my kids and I. And just this concept of a perception, I would almost kind of be curious how many people actually perceive that they're safe to begin with, because we are surrounded by, you're not safe. Your politicians are on the Epstein files. Your teenage boys are following the red pill movement. Look at this. There's 24/7 news. There's social media that's giving us this perception that we're continuously in danger. So I see what you're saying about, people being perceived that are safe, but I'll be honest, I don't feel safe very often. And that's not from trauma. That is from continuous media exposure. And I don't even get on social media very often anymore.
Yeah, it's so true. It's
Yes.
so true that we each walk the world sort of, based on, some of us are, parents were like, the world is not safe. Everyone's coming to
Yeah.
get you. Some people walk around differently. I walk around, it's kind of sort of somewhere in between, where I'm like, I might not be safe, but I'm also ready to fight, which
Yeah.
also is not relaxing, probably.
No. Same. I get it. And a lot of times people will say, we hear a lot of movement about like, it's not what she wears. I wear a lot of, Tracy knows this, I wear a lot of high heels. I love my heels. They double as a fun fashion accessory and a lethal weapon. And that's really messed up that that's where my brain goes. But I have been in many, many public situations where I have been catcalled, I have been called names, I have been so many different things. And that is not okay. And it's very difficult to, again, perceive safety when I can't go out without being seen as like an object or something like that. And then you're also seeing and hearing in the news women being attacked, like because a man entered their car, or if you have the latest one that I'm hearing is also context. I'm right by you. I'm in Kansas. And so there's also a lot of like trafficking stuff in Wichita. And so we hear a lot about that. And the latest one that I've heard is that if your windshield wipers are like up, as a woman, you're not supposed to go outside and fix them because that means somebody might be outside waiting to stab you and take you away. I don't know what's true anymore because there's so many things that are so nuts. And I have actually, in the community that I work in, I have worked with people who have been trafficked. I have worked with people who have gone through this kind of stuff. And so I would love to live in this la la land of perception of safety. So I absolutely see what you're saying. It seems like we're having these policies and these laws. I'm on a soapbox right now. We're seeing these policies and laws that are kind of like just making the policymakers feel good enough when those of us in the general public, those of us who actually are going out and about, I don't feel safe. I don't feel safe in a lot of situations. I'm literally like blocks away from where BTK committed his first murder. And that's in a residential neighborhood. Safety is a feeling, and I would love to feel that. And it's a really difficult thing to feel when we feel like our policymakers don't care putting it up.
Absolutely. Yeah. And you're saying some very, very important things, and that is so many women and men have been victims, right? We know people who have been victims. Who are the perpetrators? Statistically, it's not the stranger on the street. It's the person in your home, in your family, right? Somebody you know. Those 80%, those are the perpetrators. It's not the strangers. But do we have safety anyway? Well, right, and there is perceived safety and actual safety. I had an offender one time, and this is a lot of what motivates me to do treatment of sexual offenders. He was a guy in DOC. He committed a pretty heinous act. People mislabeled him as a psychopath. Oh, he's a psychopath. He's a psychopath. Well, I did a bunch of testing with him. He was not a psychopath. He had avoidant personality disorder, maybe. He was not a psychopath. But he was labeled as that. And interestingly, he said to me, and I've always had this in my mind, it is not the sex offender you know about that you have to worry about. It's the one you don't know about that you have to worry about. And all of us know a sex offender. We just don't know it. But when it comes to those that, well, I mean, it is, right? And it goes to that perception of safety. And what role does the media play in making us feel unsafe?
Huge.
And the reality is that we are not safe at times, right? I mean, we got to look at both. But the offenders that have been convicted, that are being supervised, that are being treated, they are far less dangerous than people think. And treatment works.
Yeah, treatment.
So when I think about that, I'm thinking, I do what I do to make this world a safer place for women, for men, for boys, right? I mean, treating offenders is absolutely where it's at. Now, if we want to do some good, let's look at prevention, sex education, identifying dynamics early, getting help for people before things get set in adulthood, right?
Yes.
I mean, those are the things we should be focusing on.
Yeah, this has been really, really, I think, helpful. And I appreciate that some people will really enjoy hearing about all the different ways that about the reality of the situation versus really what we're fed through media, fear mongering, all of this different stuff that the false protection. Oh, they're locked up forever. Now you're safe. First of all, most people aren't locked up forever. So you're just going to get somebody who didn't get treatment, who's has worse mental health. They're going to get out and they're probably going to have worse problems than before they went in. Like, that's the reality. You're not safe. There's no one out of all of the people who sexually offended me, upon me, I should say, had, for instance, had been somebody who had victimized multiple children at multiple daycares, had been through multiple convictions. This was, I believe, the fourth daycare that this had happened, and the person had been convicted, and they served, I believe it was 6 years somewhere. So if somebody thinks that the answer is just go put somebody somewhere, that's not the answer. First of all, no one's get locked away forever. And second of all, that's not even humane when the problem is fixable. So basking in that fake safety is a real problem. So knowing the facts can help you maybe also get in support of things that would, in fact, increase safety in the public, and human treatment and trauma informed treatment for all people that deserve care, which includes people who are sex offenders.
I couldn't have said it any better myself.
Yeah. Hey, you know what? Not everybody's going to agree with that, but hey, you don't have to. That's why we exist here, just to share facts. Well, I appreciate any last sort of thoughts or comments that you might have on any of this.
You know, I worked with a lot of therapists. Amongst the therapist population who treat offenders, I've noticed some that really had an axe to grind, and unfortunately, they probably made things worse. Whereas those therapists who, as you mentioned, were very trauma informed, who looked at these guys as human beings. They're human beings. They made some very bad decisions that hurt people deeply. There's no denying that. But as human beings who often were traumatized themselves, when you treat them with respect and dignity from a trauma-informed care perspective, that goes a long ways in preventing future victimization.
Yep. Absolutely. Absolutely. Yeah. This is not how you were, it's not somebody else's fault. We don't need to worry about all of that. What we need to worry about is treating people like humans who are deserving of evidence-based care so that they can get better and be productive people in society or in their families at very least. Maybe they don't want to be productive in society. Maybe they just want to be really good family members and show up for their kids and be a good partner. Whatever it is, we need to give people the opportunity to shine in the ways that they can shine.
Everybody deserves to heal. And us, three of us being therapists, it is not our place to judge the actions of our clients, of our patients. We are here to help them. And my hope is that maybe somebody who is struggling, maybe they did offend years and years and years ago, and they're really still struggling. Maybe they hadn't done it again. To know that they can actually work through that. And if they were themselves a victim when they were a child, there are people like you, MJ, out there who can say, hey, we do have to work on some of the foundational stuff. Like, you are a whole person. We have to look at this holistically. This work is very challenging. This work is very taboo. But boy, oh boy, MJ, am I so glad that there are people out there like you.
Well, thank you. There are many like me, and thank goodness.
Thank goodness. But yeah, not enough. We're still in the minority of people who get it and understand what's going on, and that's okay. And if you've ever gone to a therapist yourself or a treatment provider or anyone for that matter, and they said that, you're not treatable, you're disgusting, you have a problem, you're a predator, you're all these things, find somebody who knows what they're talking about, who is trauma informed, who can give you a different answer. And that's true honestly, with all disorders, I mean, people show up to non-evidence-based care all the time for all kinds of things. Let me try my woo-woo, magic fairy dust to make your whatever go away. There is no magic fairy dust. Sorry. I would be using it if it were. But it's hard to find evidence-based care in general. So make sure you know who you're going to. And I have to say this because this came up this week, actually. Just because somebody says they specialize in something doesn't mean that they know what they're talking about. I have to put that out there. I just got a new client myself from somebody who said, you're a predator, you're not safe, and you need to move out of the house because you're not safe around the kids or your wife. And I diagnosed this person with pedophilic and harm OCD. And I was like, oh, let me also do this other. Nope, not even similar. And I was like, please, can I speak to your wife? Like, can we all talk about facts, and whatnot? And the person who did this initial diagnosis and terrible harm to this family was claiming to have training as it was words that didn't make sense, but something about a sexual deviant specialist or something along those lines. So just because someone says they're a specialist, don't even take that. If you don't hear, wow, that must have been really hard for you, and let me try and help you figure this out, and then I would probably try again.
Be skeptical of that.
Yeah, maybe we can put some valid resources at the end of this podcast. We can put our heads together. MJ, you can give us a few to add. I know I would like to add ASECT and some other people who at least have some real knowledge, hopefully, about this topic and can help people.
Absolutely.
Right.
All righty then. Well,
all right. Well, thank you so much, MJ. This has been amazing. Tracy, any last words?
no, actually.
Okay.
Shockingly, I have no other words except no, just really, really, really thank you for being here and being somebody who can share data with us and blow our minds as much as we know about stuff. We always are learning and love this. I love having these conversations and helping spread real things around the world.
Yep, having real
Well,
conversations.
I sure hope it was helpful.
It was.
Yeah,
well,
it was informative for sure. So, all right. Well, thank you so much. And
thanks, MJ.
appreciate the conversation.
Yeah.